Okay, hi there YouTubers, it's Andre here. The reason I'm making this video is because there's a lot of especially males out there that's looking for information regarding prostate cancer and prostate cancer operations. Now before I went in for my prostate operation, I was like looking at so many videos. And it really helps getting the information that you're looking for and even things that you were not looking for. So I really hope with this video these people can get some information and it's really helpful. Okay, so before I start, I'm just gonna say this video is for an open prostate surgery. It's not for the robotic surgery, it's an open prostate surgery, so no robots were used. The reason for that is that my medical aid did not cover robotic surgery, and I had no option but to go for the open surgery. Okay, so I'm 52 years old, and normally one would come into contact with prostate cancer when there's some things that you realize that your body is it's in your body and it's not supposed to be there. And some of that symptoms is like you cannot go to the toilet, you have to push hard, and I'm not going to go through the list. The list of symptoms is there, and I didn't experience any of those symptoms. For me, it was like I was doing a blood test regularly every year, sometimes every second year. And my doctor, he just told me one day, there's something we need to monitor here. And I said, okay, doctor, let's do that. And on one of these blood tests that came back, the doctor phoned me and he said, you know what, I need to see you. So obviously I knew it wasn't good news, so I went there. And obviously my PSA level was at a level that was like concerning. And at that stage I was at 6.3. And the doctor just told me, you know what, this is concerning, you'll have to go and see a specialist. And so yeah, that's where everything started for me. So I had no symptoms. It was purely picked up on a blood test that came back. So doing a regular blood test is absolutely, it's a necessity if you're getting older, if you're getting to your 50s, even younger, but especially when you get to your 50s. Okay, so off to the surgeon or to the specialist I went. And again, he asked me, what is your symptoms? Why are you here? And I told him it was picked up with a blood test. And he started obviously the questions and what symptoms do I experience, and I had no symptoms. I said, doc, I don't know, maybe I shouldn't be here, maybe they made a mistake. And he said to me, you know what, the next stage is going to have to be a biopsy, and there's just no other way to know if we don't do a biopsy. And yeah, so 7 days later I was booked in for my biopsy. And the biopsy is like, it's really just a day. You go in the morning and you come out the afternoon, and basically they take samples of your prostate. They go through the penis, and you get a result back from that. And I must say, when I woke up after the biopsy, there's this feeling that your bladder is like full to the max. and it's like a burning sensation, and it's very uncomfortable, but it's bearable. And I mean, it's after biopsy, that is just how it's gonna be. And so in the afternoon, my wife came to get me, and I went home. And pretty much after the biopsy is done, when the operation is done, um, you just, blood will come out. If you go to the toilet and you urinate, there will be blood, and it's really uncomfortable. And the level that you can put that on is for like the first 3 days is pretty much the worst, because every time you go and you push, it's blood. And I remember in the beginning it was like jelly, blood jelly that came out, and obviously that gets better, and it takes about a month for all of that to clear up. It gets less and less and less and less, and I mean eventually it's you back to your old self. And so from the biopsy they do, that is, I mean, comparing to the actual prostate operation, that's really nothing. It's uncomfortable and it hurts, but in 30 days time you'll be back to your old self. So after that, um, based on the samples, you get back a thing that they call a Gleason score, and the Gleason score determines the progress of the cancer. I mean, it was confirmed after your biopsy. The doctor confirmed definitely it's cancer, and the level of the cancer is at this stage. I got a Gleason score of 7, and I was very lucky. The results showed that the cancer was still contained in the prostate, and which is obviously good news, because it means you can take the prostate out. But with the biopsy comes the options that you have depending on how far the cancer has progressed. And obviously, because I didn't show any symptoms, my the cancer was not that far progressed. So yeah, so the doctor told me, you know what, we can take the prostate out, or you can go for radiation. And I just decided for the prostate to come out. I mean, it's still contained, and I just thought, you know what, if we take it out, I don't have to worry. I had the option as well to for radiation, and the doctors you wanted to send me to go and see somebody so I can get an idea of that, but I was told if the radiation didn't work, then there might be other problems. Then the operation is harder to do. The consistency changes of the prostate, and that's why it makes it more difficult then to work on. And yeah, so I decided, okay, I'm just going to go for the operation. And unfortunately, my operation, while all of this was in progress, the COVID-19 came along, and there was a certain time where nobody knew what was going to happen. I found my doctor. He said, you know what, just hold on, we'll see. The operation is going to take place. It's definitely, it's important that we go ahead with it. And it was 2 months later only that the doctor confirmed a date for my operation. And obviously I had to go in for a COVID-19 test, and I did that, and I put myself in, my operation was then scheduled for the 28th of April 2020. And yeah, so everything was sorted out and I booked in. And yeah, I mean, I had an idea of what to expect and what could happen. And the operation in my case took 4.5 hours. Unfortunately, in my case, there were some complications. Not during well, you can say during the operation and afterwards. In my case, the prostate actually attached itself to the rectum, and the doctor had a battle to loosen it up. And while he was trying to loosen it up, he made the wall of the rectum, he damaged it. And obviously it becomes a concern, but I went to ICU. Now obviously we know from the robotic surgery and open surgery, the biggest difference is probably your recovery time. And open surgery is just, recovery time is much longer. I was in ICU and hospital for 11 days. I spent 8 days in ICU and the remainder 3 days I was in a normal bed. I went back to the normal hospital. And while I was in ICU, I realized that something, something was not quite right. There was like, when I was in my bed, there was a sound like I was leaking air. And if I had a fart or wind and that didn't come out, it sounded to me like it was leaking somewhere else. And I mean, it was still early days, so I thought that was normal, but that was strange to me. The doc came to see me, he told me what happened, and he did put stitches in where the prostate grew to the rectum to try and fix it. But as time progressed, we realized that one of the biggest complications was that I had a fistula and I was leaking air between my bladder and my rectum. So that was obviously the doc couldn't go back in there and look at everything and try and fix it. And I was actually, my recovery time, regardless of that, my recovery time was good. And total of 11 days in ICU and the normal hospital. And yeah, so obviously you wake up with a catheter inserted in your bladder. Now one thing that I didn't see on any of the videos or heard anybody talk about it is that on my second day in ICU, the catheter started to leak. I had like droplets coming out the front of my penis where the catheter exits, and that was a concern to me. But the doc came to visit me and he said, yeah, I shouldn't concern myself too much about it. So for those people out there that's still gonna go for the operation, the catheter can leak, and it's just, don't worry about it. It's the amount that it leaks is so little that it's fine. I mean, you find ways to deal with that. Yeah, so that was really concerning to me, but as time goes by, and the doc says, no, it's fine. You think, okay, so it's normal. Okay, so I went home, and the catheter stays in for another 7 days, so it stays in for a total of 2 weeks. I went back to the doctor's office, and they took the catheter out. Now, taking the catheter out it's really uncomfortable when they pull it out. The end of it is still bigger than your penis, even after it's deflated. And when it's pulled out, it hurts for about 1.5 seconds, maybe 2 seconds. And the burning sensation is back, but that quickly goes away. An hour later, that burning sensation was away. And the problem then is, since your catheter is now out, all the urine has got to go somewhere, and you just realize how much the urine bag at the end of the catheter does actually, and you can ready yourself that you will going to leak when that catheter comes out, and that really puts you back, because you have to put a nappy on immediately, and you just leak. When you get up, you leak. When you walk, you leak. When there's pressure, you leak. So you're onto the nappies, and there's various nappies there. I don't have nappies and pads with me, but you can get those nappies in any size and any shape that you want. So you can have a look at your pharmacy or places that sell them, and there'll be something for you that's going to work well. So 3 days after my catheter was removed, I just didn't want to move, because at that point, when I was down, as like sleeping in bed and sitting down, I would